My ideal client is an educated client. My ideal client is a client who wants to stay healthy, not just for the few years that they're going to be young and beautiful and vibrant, but for the entirety of their lifespan, whether they're in their perimenopausal state or whether they're in their menopausal state or postmenopausal state or post-andropausal state. I want them to want to be healthy, and that desire leads them to open their brains up to different other protocols that are currently available in the market. And those are my people. Hello. Today is the perfect day. We picked a perfect Friday to go live. All right. I am back to answer more questions and to introduce myself if you guys don't already know me. Again, my name is Dr. Din. I am the doctor who works at Juvanni. Juvanni is an anti-aging center in New York. And I am board certified in family medicine. I am also a geriatrician. However, I retired from geriatrics around 13 years ago. And I started doing anti-aging. People ask me all the time, why did I retire from geriatrics? And I always tell them that I had seen the other side of darkness. In the United States, there are two different kinds of healthcare. One is that is managed by your insurance, health insurance, and that is the kind of healthcare which is pretty much like sickness management. Your healthcare, which is managed by your health insurance, is basically sickness management because your health insurance acts like an auto insurance, like a car insurance. So it only gets activated when you fall sick or develop a disease, and then they provide to you treatments, or if you need hospitalization or some other rehabilitation, they will help you with that. However, there is another form of healthcare which is targeted to your wellness and to your continued health throughout your lifespan, and that is something called longevity medicine. And longevity medicine is an out-of-pocket cost for most people because your health insurance is not going to cover it. It's like just like your car insurance sometimes may not cover the oil change and the cleaning and the denting and painting of your vehicle. Similarly, your health insurance may not cover your cleanse, your oil change, your denting, painting, your protocols to preserve the system of your body. And what I did was a long time ago just turned my career from a sickness management protocols to proactive management of health and wellness. And that's the story. Sometimes people ask me that who is my target client? And that's a very interesting question because now once you reach my age, and I am most likely older than anybody who's watching me right now, but if you are my client, my hope is that my ideal client is somebody who's not old yet. Like you, I feel that the people that I can help the best are the ones who are still young and they are perhaps somewhere in the pause life. So if you're somebody who's dealing with perimenopause or menopause or andropause, if you're a guy and you're beginning to experience that decline, that naturally programmed decline in your system, then you may be somebody that I would like to speak to, because there are now treatments and protocols and definitely things that you can do to help your body stay in wherever it is for a much longer period of time. Who is the ideal Juvanni client and what problem do you solve for them in one sentence. My ideal client is somebody who's experiencing a pause in their life. And a pause is something that starts happening to us when we hit our late 30s or 40s. And that is like basically if you were a vehicle that's carrying your consciousness, your body will start feeling as if sluggish. You may end up feeling a lot of fatigue. You may end up seeing different changes in your, not just your appearance, but also you would feel that just like when you were young, when you would go to sleep, you would wake up refreshed, and the same rejuvenation and restoration that you experienced when you were much younger is no longer there. So it's very difficult to answer this question in one sentence, but definitely it's somebody who is experiencing perimenopause, menopause, or andropause are the people I like to talk to, because those are the people who, once they understand what's going on in their body, are literally helped immensely because they know what to do next and they know how to stop themselves from declining any further. Because human life is a unidirectional state. So currently you're born and then you become young and then you stay in that period of youth for a few years to maybe a decade if you have great genes and if you're very fortunate. However, after a certain point of time, that energy and that vibrancy and that power that you have, it starts dissipating. And then as it dissipates, you also realize that several parts of your body are losing their peak functionality as you get older. So we do like to call those phases of your life by certain names. For example, when we say that a woman is going through perimenopause, we know that this lady may be in her late 30s or in her 40s, maybe up until early 50s, because it's a period of time that lasts in your system. And then basically, what is perimenopause, you may ask? So perimenopause is like brief pauses that happen into your system. I feel that a lot of people do not really understand when we tell them about the pause, because they think that menopause in women is basically the time when they're no longer producing the hormones and they can no longer become pregnant, or they do stop having their period for a certain amount of time. However, it's a lot deeper than that. Menopause or perimenopause, it's an all system pause. So perimenopause is like brief periods of pauses. Your body slumps down into a pause, into a state of like some sort of frenzy, targeting one or the other system. But your body automatically, through rest or through relaxation or through some treatments, can get lifted out of that pause, either naturally or with some assistance. And then you go back to your normal routine, and then it will slump back into a pause, because perimenopause is like your body staggering through life, and it has like these slumps where you just don't have the energy to live your life the way you used to experience it in your youthful years. But menopause is very different, where that pause becomes kind of permanent. So permanently, yes, the body has stopped producing certain hormones and certain recovery molecules inside your system that will help you recover. And at this point, this is not just a hormonal pause. This is an all system pause. So women come to me all the time and they are complaining from muscle aches to joint pain, from sleep disturbances to digestive issues, from immune problems. Like it's also an immune system pause. So you can get sick fast. You just routine fatigue just catches up to you, and you start getting sick very quickly. And recovery takes longer because you're not sleeping well because of the muscle aches and pains. So it's like women also complain about brain fog and forgetfulness because they just cannot come to terms with how to turn their system back on again. So that pause has to be recognized in a lot of women. And I feel that a lot of doctors these days are now catching up with this information, because for the last 10 to 15 years, menopause and perimenopause have been mismanaged in United States, and actually not just United States, all over the world. And this debacle with the pause life happened because we did some research where we failed to draw the conclusions that we were supposed to draw correctly. However, we're very quickly catching up with that information, and people like me have been working in this field for the last decade just to help people lift their bodies out of their pause life and get back into the flow of things, and the flow of whether it is your thought, whether it is your actions, whatever it is that you're supposed to be doing. We want your body to be capable of fulfilling whatever destiny you're supposed to lead for yourself. So pause life is a period of time which you will have to, which most women spend in without a lot of assistance. And but the tables have turned. Now you have a lot of assistance. You have people like me all over the place in United States who are ready and able to assist you, and not just with our words, but with also treatments and supplements and energy devices that will bring back life into your system, whether it is your skin, whether it is your hair, whether it is your internal organs that nobody can see. One other problem with the healthcare system is that it fails to recognize the metabolic slowdown of aging, especially the menopause or perimenopause also. It leads to a lot of weight gain in women, and there is no way that they can get rid of that weight once it starts accumulating. And for the first time in human history, we have treatments and medications that we can actually give to our perimenopausal and menopausal ladies, or even men who are experiencing andropause and experiencing metabolic slowdown and sugar intolerance and everything, and hormonal imbalance. We can give these supplements and medications to them too. Tell us about your journey through longevity medicine. So longevity medicine is basically a form of medicine. It's an emerging field in modern medicine, where basically there are doctors who train in not just helping you when you're sick, but people who basically, like myself, have studied for over a decade in trying to assist people to maintain their health for the entirety of their lifespan. Because your lifespan may be, modern medicine has increased your lifespan. So your ancestors just 200 years ago would be lucky if they stayed alive past 50. But nowadays, we take it for granted that people will live, like average age in the United States for women is in their 80s. For men, it's like also in their like late 70s and early 80s. So, however, the last 10 years of your life in United States, or actually all over the world, are, even though we have increased your lifespan, we have not increased the quality in that lifespan. And that is something that people who are in longevity medicine are working on, that how to make your health span to match your lifespan. So if we are making you live long, we should also put a lot of effort into making sure that you live that life with agency and with health, so you can go ahead and accomplish things that you need to accomplish within your extended lifespan now. Otherwise, what is the point in living a very long life if you're just going to suffer through this disease and that disease? Currently, as is, when people sometimes come and they talk to me and they say, "Oh, I want to age naturally," and I'm like, aging naturally and aging gracefully are mutually exclusive, by the way, because you cannot age naturally and keep extending your lifespan, because naturally when you start letting your body age, it is going to at some point disintegrate, because your body is programmed for these pauses. Because a menopause is basically is a programmed pause, which is programmed built into your system, because it allows your body, it tells your body that your time on this planet is over. It allows you to eject your system, your physicality, out of the matrix of life and health and wellness. So it's supposed to, like, if things did not impact you this year of your menopause, wait for like a couple of more years and something's going to happen to you. So the current system basically makes us experience aging like sitting ducks, where different diseases will just come and afflict us, and then we go to your doctors and the doctors will say, oh, you have this disease, and here is a medication for this disease, and here's a medication for that disease. And by the time you're 60 or 70, you have like 6 or 7 different medications that you're taking for different health concerns, or which are basically different diseases. However, the other side of this story and this education is also preserving health. So just like there are medications and to solve your problems once a disease has happened, there are also supplements and treatments and energy devices that are now FDA approved and present and are available in the United States market at least, which can assist you in keeping your system together in health and wellness, not just for the few years that you're going to be young and vibrant, but for the entirety of your lifespan. And I tell people that proactively managing your health is also a thing, and that's the basic philosophy of longevity medicine. So people who are in longevity medicine only deal with people who are healthy, who are completely inspired to stay healthy and keep themselves together. They want to preserve their systems for as long as they can. And listen, we all are fighting our genetics, because the way you are not in competition with any other person but your parents. You are a combination of your parents, and then the diseases that your parents carry, they will send it forth to you, and it is your problem to now figure out what happened, what you have inherited, and how you can navigate your lifespan through all the twists and turns of health, wellness, and any diseases if they were to manifest, and how you can stay out of certain problems. So yes, longevity medicine is a new emerging, it's a very fast, there's so much progress that has taken place in this field, and I'm super excited to share this knowledge with my followers. My ideal client is an educated client. My ideal client is a client who wants to stay healthy, not just for the few years that they're going to be young and beautiful and vibrant, but for the entirety of their lifespan, whether they're in their perimenopausal state, or whether they're in their menopausal state, or postmenopausal state, or post-andropausal state. I want them to want to be healthy, and that desire leads them to open their brains up to different other protocols that are currently available in the market. And those are my people. My people are the ones who don't want to get sick. They don't want to go to nursing homes. They don't want to spend the last 10 years of their lives in a nursing home waiting to die, or waiting to, let go of everything. I want the person who should come to me is the one who not only wants to stay connected with versions of their body and their selves that they like the best, but where they feel the most in flow. And where most of the people who come to me are also people who have a purpose in life, and they are like, my purpose is not going to be, is way beyond me, just me, and it's like they see themselves as part of this whole which needs to do something with themselves. And those are the people who will proactively try to preserve, and because they like their lives. So yeah, those are my peeps. And I have like another subset of clientele who follow me because I am a skin tailor and I do a lot of treatments for skin. So if you are somebody who wants to always look like you don't want to change and become like somebody else, you want to preserve your own sense of self, then also those are the people who come to me, because we preserve your skin and your hair throughout your lifespan. What's the difference between regular Botox and migraine Botox? So Botox is one of my favorite, fastest anti-aging medications of all time. Basically, it is an injectable medication that we place via a very tiny needle under your skin inside your muscle. Botox acts like a meat tenderizer. So it basically relaxes the muscle so that you're not scrunching your certain parts of your visible face too much. And sometimes by relaxing the muscle, not only the appearance of skin becomes better, because the skin does not once when people are scrunching their foreheads 700 to 800 times every day, they can disrupt the blood flow and the lymphatic flow to the skin, creating just the aging of this area faster than some other parts where you're not scrunching the muscle that much. However, because this is your face, your public facing face has certain areas through which you not only emote, but when you talk to people identify you as you by looking at your face. So these areas require routine anti-aging treatments. And since Botox is an anti-aging medication, we basically place it in certain parts of your face to relax the muscle so that it doesn't scrunch and disrupt the flow of blood and lymphatics to your skin. Now, what is the difference between the anti-aging Botox that we place around your face or around your neck in this area, and the treatment for migraine headaches, which is a disease condition? So migraines is like a very bad, the worst headache of your life that can occur because of a wide variety of things, from which sometimes it's genetic, sometimes it's something you ate, sometimes it's just different environmental factors that can create tension in your muscles of your head and your neck that just do not get released by any oral medication. So migraine has a lot of different medications that we can give to people, but if they fail all the medications, then the best treatment for a migraine headache is to give them Botox treatments. Now, Botox for migraine headaches is basically it's just a dosing thing. So for beauty, you will place it in different parts, but for migraine headaches, we place it in the scalp, we place it in the neck, we place it in different other parts of your body also. But for beauty and for skincare, the Botox that we place is supposed to be very microdosed. It's a microdose. I will tell you in such a way, I don't know if many of you who will be hearing me speak about this may not know, what are the different doses, but let me just explain how these dosages work. For migraine, for instance, the recommended dosage is like from 100 units to 150 units, which is given to people every 3 months. However, for longevity of your skin and for like cosmetic Botox, is probably for that same person who's getting like 150 units for migraine Botox, another person of that exact same age who does not have these crazy worst headaches of their life kind of headaches, for beauty, that dose might be 25 units. So the discrepancy, basically how you tell that migraine Botox is different than cosmetic Botox is not just the placement. Your doctor is going to place it in ways where it is going to be very aesthetically pleasing, because we are not trying to freeze you. But for migraine, your doctor might freeze your muscle so that it doesn't even move at all, because the headache of a migraine, it creates a lot of inflammation in the system, and people really feel very sick. So that's the difference. However, for longevity, we don't want to freeze your muscle. We want you to be able to have all movement, because the movement is essential for you to, experience your features. And that's that. But for migraine headaches, your doctor may place a way, like the as much Botox as needed to remove the headache. Got it? So that's why, and migraine Botox and beauty Botox differ. I've had clients who came to me to see if their migraines will get relieved with just the Botox that we give for beauty. And people who have actually true migraines, they just need a lot more Botox. So that's that. And again, for migraines, your Botox may be covered by your insurance. However, for longevity of your skin, your Botox for sure will not be covered, because that's considered cosmetic. Even though your skin is not just the largest organ of your body, but the skin of your face is how your brain perceives you as you, and how other people perceive you as you. And as your skin ages and falls apart, it has an impact on your life and on your brain, on your psyche, because when your skin fails, chronic skin failure is a thing, and Botox will prevent that chronic skin failure. So chronic skin failure will fail your skin and will drop your skin down. And as your skin fails and falls, it drags your psyche alongside it. Your concept of chronic skin failure, what is it, and how do I know if I have it? So chronic skin failure is, so just like every organ in your body is aging. After you've been young and healthy for a certain amount of time, you've achieved your peak, you carry that peak on for a certain time, and after that, as the body starts declining, all of its internal organs start declining. So our heart fails, our kidneys fail, our brains fail, our immune system fail, our muscles fail, our bones fail. Everything is gonna at some point go away. Your body is a vehicle, and you're a perishable. Humans are our body is a perishable item. So everything inside us is aging and is going to fail at some point. But when the internal organs are failing, we treat them. We give you medications, we give you surgeries if you need them. Like when your heart is failing, we'll put like a stent in it. We'll do different kinds of treatments and bypasses so that the blood flow does not get interrupted. Similarly, when your skin ages, as it ages, it's chronic. It's basically what happens to skin is that it's constantly growing. So every year you have like you'll experience a tiny bit of growth. So when you're young, the skin is going to grow like very tiny bit. But as you age, after a certain point, since the body stops producing different elements that will keep you youthful, what ends up happening is that the growth accumulates, and that growth is, shows us how skin failure, so that is like chronic skin failure that starts accumulating in different parts of your visible face. However, that skin failure is happening all over because your skin is the largest organ of your body. But we can recognize the failure first in the skin of our face, especially for your brain. Your brain can tell where you are in time, where your body is in time, just when you look at yourself in the mirror. And when other people look at you, they can look at you and also tell if you're old or young just by how your skin is appearing. So chronic skin failure, when it accumulates for decades and decades, it just creates a sag into the skin, which cannot be relieved with just routine medications anymore or oral treatments anymore. That is like something that where you need to start doing certain things that are like a little more invasive. So chronic skin failure is basically skin failure that is chronically accumulating in your skin, and not just the skin of your face and neck and under chin, but all over the body. And there are treatments that are now FDA approved for your whole body and definitely for your face. And I hope that makes sense to you, but let me know, please let me know in the comments if this is something that you'd like to learn more. So what kind of vitamins can be applied through IV infusions? And IV infusions, basically, IV infusions is IV stands for intravenous. So these are intravenous infusions of water-soluble minerals and nutrients and vital amines, also known as vitamins, that I like to give intravenously to men and women, especially after their menopausal years have started. Because menopause is not going to just pause all your other organs, it will also pause your gut biome. So your gut biome is going to be living a very retired life by the time you're in your menopause. So it's not going to open its doors and let every crap that you place in your mouth inside the system. Your gut biome is your first line of defense. It is that part of your body that protects you from what you place in your mouth. When you take any food or any oral, even supplements, what ends up happening is that these supplements and that food is going to get like a strict bath of acid inside your stomach because your stomach is going to clean it and like really turn it into a nice little paste before it sends it down to the gut biome. So by the time it goes down to the gut biome, not only the transit of food is very quick through the gut biome, but also the other thing that happens is that the gut biome only opens its doors for the things that it recognizes. For example, some protein and some minerals and water, some fat soluble vitamins that it can still recognize, it will let in. But the water soluble vitamins, which are super important for your skin and hair, sometimes just can't make its way through your stomach all the way to your skin, because they just get denatured in the stomach acid bath. And your gut just can't recognize most of those things, and you end up pooping them out. So when people say that, oh, vitamins don't work, that's not entirely true, because vitamins do work, but many of the vitamins that actually you need just can't make it to your skin and your hair, because they just get lost in the translation through your biome. So for menopause, one of the ways that we are helping people is by giving them many of these minerals and nutrients and vital amines and antioxidants intravenously. And that is helping people with their energy, basically with their skin and hair. Listen, during menopause, one of the most important complaints that women do and tell me is hair loss and hair thinning. And you know that somebody's in the pause when they go and get their hair cut, because their body cannot sustain long hair anymore. Because remember, your hair, and if you've not heard me say this before, know that your hair is basically just an extension of your skin. And when the energy is not given to your skin, it doesn't reach your skin, it will not get translated to your hair either. And you will, I have company here, but still. So we cocktail these infusions for you, and I am one of your most favorite infusionists, and this is something that I do love to do for people. And if you've never experienced an anti-aging skin and hair infusion, it's an amazing thing. Your skin, as the largest organ of your system, deserves the care that we have now figured out, but it's again an out-of-pocket cost for most people. So I just like to tell people to go and find it. Top three habits that visibly age the face after 45 and the fastest fixes. So, the three habits that visibly age the face after 45, number one is smoking. Smoking is going to age you. Number two is alcohol. Alcohol intake after 45 is, I tell women to stop that, because alcohol is very dehydrating. It also takes a lot of reserves from the liver, and your skin suffers, and it creates a lot of inflammation under your skin. The third habit would be not using sun protection. If you're always out in the sun and you're not using any protection or shielding yourself, you're damaging your skin, because humans have a very toxic relationship with the sun. We love sun, but sun is not good for us. And I always tell everybody that make sure that avoid direct sunlight. And even if you do go out in the sun, make sure that it is during times of the day when the sun is not like too harsh for your body. So do it in the early mornings when the rays are at a different slanted angle, or do it at a later time in the evening when it is like setting and it's again not too severe. And if you have to go earlier in the day, then make sure that you are wearing things that will protect you from some of the harmful rays entering your skin and damaging the parts of skin that are like under construction, because your skin has three layers. There is a top layer of your skin where you meet the world. Then there is a middle layer of the skin where all your problems are, such as your hair follicles, your pigmentation, your collagen support, all of your blood flow, everything is in the middle layer. And then there is like a bottom layer where your skin, where the new baby skin is being formed inside, where the under layers of your skin meet the inside of your body. And that's the layer where new skin cells constantly develop. Now, the top layer of your skin, where you meet the world, is made up of essentially all dead skin cells. So when you look at somebody, you're basically looking at dead parts of somebody. But sun rays, many of the rays, they will go all the way through your skin, all the layers of skin, and deposit injury into the deeper layers of the skin where new cells are being formed. However, if you have pigmentation, if you have melanin, which is like a internal screen of pigment in the middle layer of your skin, that will give you a shield. So if you're dark skinned, or if you're brown, or if you have like different pigment inside your skin, you are naturally shielded from the sun. However, if you're white, for instance, completely, then you do not have that pigment. So sun is going to go through and through you. So we see white people all the time who have such severe pigmentation, and they need to constantly remove the sun damage every year with things like lasers, so that the dysfunctional or damaged pigments that are created, the injury that is created by sun, does not convert into cancer. However, if you develop skin cancer, your insurance will cover the treatment for cancer. So thank God for that. What is menopause? Menopause is an all-system pause in women. It's my favorite topic in the world at this point, because we have a new awareness of how to manage our pause life. Every woman has to learn what a pause is, and then she has to manage it. And she has to manage it with the help of whoever is her favorite doctor to help her with the pause life. So menopause is not just a pause for your hormones and your menstruation and your capacity to be fertile and your capacity to birth a child. Menopause is an all system pause. It is a brain pause, it's an immune system pause, it is a gut biome pause, it is a muscle pause, it is a bone pause. It is a pause. It is going to arrest your energy and is going to put you in a very tough position. It is also a metabolic pause where you're going to start gaining weight. You will have cycles of fat. I see women, suddenly they have 20 pounds weight, which is just around their midriff. So that is like a pause. So that's a pause life. How do you lift your body out of your pause? That's like, again, a complete longevity medicine protocol. And for that, people come and we have a system where we help you to lift your body out of whatever pause is creating the most havoc in you. Ultherapy. My favorite next question is about Ultherapy. So one of the things that will prevent, so chronic skin failure, when it starts happening to women, it starts happening to women during their perimenopausal life. So during that period of time, the skin will start losing its vibrancy, its collagen, its elasticity, and you will see, and you also start noticing that it's expanding. Your skin is loose and saggy, and the reason is because it has grown so much that it cannot keep the fabric together. Your skin is like the most expensive fabric that you will ever own. So as it expands, it just can't keep itself together. So it sags and falls. So that's how we tell that your skin is fading, because it cannot, your features change because everything is dragging. So your skin, if we want to turn it back to life or reattach you to a prior version of self, we start you with certain medications that are injectable, like Botox, you may have heard of, or you may have heard of hyaluronic acid fillers. One of my favorite things, and yes, definitely the intravenous supplements, infusions of supplements that we tell you to take for hair and skin support. But there is one other medication, energy device that is FDA cleared for a non-surgical facelift. It's called Ultherapy in the United States. These are basically frequencies of sound that are created that we place under different layers of your skin. As I was previously explaining, that there are 3 layers of your skin. Your skin is composed of 3 layers. And so these frequencies of sound are placed in all these layers. And what ends up happening is that these frequencies recharge your skin and bend time in your favor by making it tight and strong. So when you place a frequency in the top layer tightens and lifts. The middle layer has a lot of collagen, so the middle layer has a different kind of frequency that makes it strong and makes the collagen like sit nicely with each other together. And then the layer that is like very deep, we can also place very deep layers under the skin, which will create a lift in and bounce into that area too. So basically, Ultherapy recharges all the 3 layers of your skin, and wherever you place this energy, this is basically an energy device that you will be turning time with that energy device. Now, when you're in your 30s, if you start using Ultherapy, you may find that you need it once every 2 or 3 years. When you're in your 40s, most women need it once a year or once every 2 years. By the time you are turning menopausal, which is like after your 50s, you should be recharging your skin with either Ultherapy or something that is similar to this device, and basically turning time and bending it in your favor. Basically, what you'll be doing is that you will be preventing the chronic skin failure from happening in the first place. And when you do it year after year after year, it basically helps you in a way where your skin is not going to just sag helplessly. And because remember, if you let chronic skin failure accumulate in a certain area, then this particular treatment may not do the trick for you, because you may then go and need a plastic surgeon who may excise the extra growth that has already taken place and may sew you back. And once you do cosmetic surgery, then you can come back and start recharging your skin and keeping it, preserving it in time. So Ultherapy is a proactive management of a routine management of preservation of your skin. So it's very good. There is no downtime. There is no aftercare. You just place these frequencies in. I sometimes tell women that, for the next month or two, to use a chin strap or something that allows your muscle to get used to a new normal, and sometimes that basically enhances the results that you will get. But otherwise, there is no preparation. However, Ultherapy hurts. Ultherapy, especially in my office, we've been doing Ultherapy for like the past 12 years. And like, we're very proficient in how we do this. So we have our old machines, and we also have a new machine that just got released. So the only difference between the old machine and the new machine is that the new machine is a lot less painful. It is very doable. It does not have a downtime at all, and it also shows the results faster, because I think what they've done is that the delivery of the frequencies, they've made it so quick that it doesn't hurt that much. However, the new machine is also more expensive. So sometimes if you're like restrained by budget, then you just have to wear more paint. If I can only do one anti-aging treatment this fall on a budget, what should it be and why? So if you're young, the first thing I would tell you to do, I will examine you and see where you are in time and what your symptoms are. So if your symptoms is fatigue or lack of energy or something like that, I'll say go do an infusion a couple of times, and this will lift you out of your fatigue. If your symptoms of aging is metabolic slowdown and you've gained, like, let's say 20 pounds, I will tell you to go and do a couple of months on a GLP-1 agonist so that you can remove the weight that is accumulating on you, and then let you go. If you are somebody who is experiencing skin failure, for instance, you're experiencing loss of collagen or something like that, then I may tell you to go and experience some baby Botox or a hyaluronic acid filler to see if that rejuvenates you. So everybody is different. This is something that when you meet the doctor and you tell them what is ailing you, then so there's not like one some cookie cutter thing that everybody has to go through. It's like every human has a different story, has a different vibe, has a different lifestyle, and also has a different budget. So we try to do what you can afford, but what is also the most important for you. And sometimes, what I feel is very important for you, you may not be able to afford it. So then I'll have to come up with the second best thing that you should do. So, for that reason, you may need to come and meet me. And I may end up doing a lot of blood work also to see where you are in time. A behind the scenes moment at Juvanni that made you smile this week. Well, one of the things that makes me very, very happy this week and for I think entirely this year is that I took a break from lunch by doing dance lessons, and I get my dance teacher here, and my dance teacher is basically a belly dance teacher, and this week I made her do TikTok virals, K-pop, and so my belly dance teacher is teaching me K-pop steps, and that made me smile. And I think we did a lot of good work, and I think I also posted it. So yeah, behind the scenes we do a lot of movement. So I tell people that even if you're working, go and move your body. So move your body is a very essential part of anti-aging and longevity. A patient question that surprised you recently and how you answered. There is no question that surprises me anymore because I've heard it. Like, please surprise me if there is a surprising question. But this week, I'm going to keep a track of if anybody shocks me or surprises me. Maybe I'm jaded. I don't have any surprise questions. We are not surprised with any question that you have. Listen, human body has two faces. One is your public facing face, and this is where how you identify you and how other people identify you as you. But there is also another face, which is your pelvic face, and that is your private face. And as you go through time, both of these faces get impacted. So when you're going through menopause or when you're going through andropause, you are going to not only experiencing the aging of your visible face, your public facing face, but also your private other pelvic face. So if you're a female, you may end up having problems with frequent UTIs, from vaginal dryness, from painful intercourse, from lack of any sort of joy from activities that used to bring you joy. So, and if you're a man, you may experience prostate problems. For men, prostate is like breast for women. So they may have prostate issues, they may have erectile issues. They will have metabolic slowdown also, which will create trouble for all of their other actions. And with prostate issues, they will have urination problems also. Women also have urination problems and lack of urinary control issues during menopause. So these things are so we deal with these menopause and andropause. So a lot of problems that anybody can come up and tell us, that's exactly what we're dealing with. Now, just like Ultherapy recharges your face and turns time back in your favor, similarly, we also have energy devices for your pelvic region. And that is something that, just like your face needs a non-surgical lift here every year, your private face also needs a non-surgical lift with some energy treatments and some laser treatments down there, whether you're a man or a woman. And we have both those devices. So we at Juvanni, we have facelift, which is like a device for women, and we also have Alma Duo, which is a shockwave energy dispensing device, which is FDA cleared and approved for both men and women. And what it does is basically this is specific energy that once it's placed in the tissue of your pelvis, it creates new blood flow. It's a phenomenon known as angiogenesis, which means that it creates new blood flow and blood supply, and so your tissue is not going to die. Because remember, as you go through pause, the pause is there to make your tissue die. It is supposed to eject you out of the matrix of life. So that is the reason, and fertility. So that is the reason that doing some of these energy devices when your problems of pause life are just initiating, are just beginning, is the best way to deal with the pause life. Don't let it pause. Don't let anything pause you or your life. Chronic skin failure will have an impact on your psyche because your skin cells and your brain cells arise from the same matrix of the embryonic tissue that you arise from. So chronic skin failure will impact your brain because your brain cells and your skin cells are related. When you were just one cell old, when you were a tiny little embryo, the outer layer of that embryo, which is called the ectoderm, divided into two. Half of it became your skin cells and the other half became your brain cells. So your brain cells and your skin cells are quantum entangled at birth. And your brain views your skin and knows where it is in time because it has memory. Your brain has memory of all your ancestral DNA that your parents have passed down to you. So your brain can tell where you are in time. And if your life is very rough and very stressed and very unsupplemented, then what ends up happening is that you may age faster than some of your ancestors. So I see all the time that sometimes your parents may have great genes, but the same kids, because they have developed different habits, they will not look anything like their parents. But I've also seen that if you have great genes, no matter how badly you treat yourself, your genes will last through that trouble. So that is that. So chronic skin failure will have an impact on your brain, and it will drag your psyche down. And if you don't believe me, please go and visit a nursing home close to you. I want you to go and sit with the nursing home people, residents who live there, and see how they feel. And in my opinion, I used to work in a nursing home. I was a geriatrician, and I saw firsthand how miserable people were with their bodies and with their sense of self and versions of self that were unfolding without any assistance. And it's very hard. It has an impact because you can't recognize who you are becoming. What treatments do you recommend in your 30s? So in your 30s, you don't need much. But if you're a female, and if you're a woman who has gone through a couple of childbirths and your system has expanded and contracted a couple of times, you might need some skin tightening. And you might also need some vitamin infusions for energy and just skin and hair, because sometimes when women give birth, they tend to not only gain weight, but they also lose their hair and their energy. So, and especially once you have a child, right after the birth of a child, your problems are not over. Your work just is beginning at that point. So you need a lot of energy to raise a child also, because humans, we have to babysit our children until they are 25, because the prefrontal cortex in a human brain forms around 25. So basically, when you have young children, they can't make sane decisions until they turn 25, and that is just the latest information that we have. So yeah, so if you're like a young mother, you need energy treatments, you need like a little tightening treatments, and maybe a little bit of weight loss, because it's hard work for your heart to carry excess weight. And now weight loss has become so possible because of the GLP-1 agonists. So what are GLP-1 agonists? I saw a question about GLP-1 agonists. It's a very important new medication of our time. One of my most favorite advances in medicine just occurred a few years ago in the form of GLP-1 agonist. Just like Botox reverses the age of your skin, GLP-1 agonist is like Botox for your fat cells. The fat cells in your body are forever cells. The fat cells in your body is like plastic in your system. And your fat cells never die. They only multiply. And your brain cells will die faster than your fat cells. So one of the things that has rehabilitated fat cells in our bodies has been GLP-1 agonists. These are basically sugar neutralizers. They were originally FDA approved for diabetes management, but then they realized that by managing the sugar, controlling the sugars, we basically rehabilitated the fat cells, and the fat cells let go of their inflammation and let go of hoarding food, the energy in our system, and people lose weight with that. And it is also so beneficial because sugar is basically another toxic substance alongside alcohol, which disrupts the systems of all the systems of our body. And especially after menopause, just like you should quit smoking and alcohol and excess sun exposure, you should also control your sugars. And it's hard to control our sugars because Not only they're pervasive everywhere in all our food. GLP-1 agonists, like, so if you need like a couple of months of GLP-1 agonists when you're young, and you have some weight problems, you can start the GLP-1 agonist. However, just know that for the first time we have a medication that you can continue using for a very long time. You like, just when 10 years ago we used to have medications that we could not give continuously to people even though they needed it. So people had like this yo-yo diets where you would lose the weight and then gain it back, and then lose the weight and then gain it back. But now we can just support you with something like this, and it's going to just keep you together for a lot longer. What is the anti-aging treatment that you like the most? Now, this is a beautiful question. However, I feel as if you're asking a mother which child is your favorite, because I, as a longevity doctor, I have learned all these treatments, and I have learned to drive all these lasers and energy devices over the past 15 years, and it's very hard for me to say which one is my favorite. But if I have to, if there was a fire and I can only save one machine with me, I'm gonna just take my Ultherapy and run out. I'll take my Ultherapy and take some transducers with it and run out. No, I'll also take some Botox and fillers. Botox and fillers I can buy from somewhere else, but these devices are like a little bulky. So the big ones I will not be able to run away with, but with the small ones I can take a bag. So I'll take as many things as I can and run out. I guess that's it. All right, guys. Thank you. I think I answered a whole bunch of questions. Have a good one, and I'll talk to you tomorrow. Bye.